Now to matters health, contraception is a way to prevent pregnancy. However, for people living with HIV, there are some particular issues to take into account when choosing a contraceptive method. However, for teenage girls, this is a discussion that most parents would rather not have. And as our health affairs reporter Winnie Lubembe tells us, avoidance of this rather sensitive topic is costing the lives of many young girls through unplanned pregnancies and backstreet abortion.
A study set out to investigate the socio-economic factors closely associated with adolescent age at first sex by using the Kenya Demographic and Health Survey 2008-2009 was conducted in 2010. The study sample carried out among 3,511 adolescent women aged 15 to 24 years showed that 61.9% of the adolescents were already sexually experienced as at the time of the study. With the increasing number of sexually active teenagers, reproductive health experts are now calling for the introduction of contraceptives to this age group, considered as a key population.
Preferred were not sexually active, but the world around them also is not keeping them in that safe environment. So when they're sexually active, I think it would be good if we can address the issue, how to protect them.
Dr. Nelly Mugo, an obstetrician gynecologist and a principal research scientist at the Kenya Medical Research Institute, says making access to reproductive health services possible to adolescents will make it easier to curb cases of teenage pregnancies, early marriage and abortion.
So as a gynecologist, I've had the misfortune of removing rotten uteruses, cut up guts from instruments that have been introduced by young women desperate to terminate. And we know that the death rate, one of the highest causes of maternal mortality, is unsafe abortion. So access to contraceptive also protects girls from unsafe abortion.
In June 2019, results from the Evidence for Contraceptive Options for HIV Outcomes ECO study put these priorities sharply into focus. Jackie Wambui, who was actively involved in this exercise, tells us that women and adolescents need more choices for contraception and HIV prevention at the same clinic.
Girl may be led into sex work, not because of wanting, but because of a way for her to survive. And she may be using sex, not even just commercially, to pay her school fees, to pay her where she's going to stay because her parents are not well to do. So she has to do these kind of things. So that kind of setup is what we are saying. We want a young girl, once she accesses the facility, is just to have these choices there for her.
With culture, religion and general societal expectations being a factor, we sought to find out what the public thinks about allowing their teenage girls to access contraception.
Mtoto akipata akitumia family planning, akifika age ya kuolewa labda anaweza kosa mtoto, anaweza kuwa na shida mbeleni.
Ni vizuri tu msichana akivumilia asome, akifishia miaka 18 and above, ajue sasa yeye ameshatosha, yeye ni mwanamke, anaweza oleka, lakini kama baada ya shule anaweza jitunza tu.
Mambo yenye inaambiwa hao watoto wa 16 years ifai kupatiwa hiyo kitu. Juu ni kukosea na ni kuonyesha watoto na wajafikisha inchi.
Mukifanya hivyo watoto watalipika. Hiyo ni kuharibu watoto.
According to United Nations Population Fund, every day in developing countries, 20,000 girls under the age of 18 give birth, amounting to 7.3 million births a year. However, 3 million girls in this age bracket resort to unsafe abortions, risking their lives and health. Winnie Lubembe for Ebri TV.